And it was found that Adapto-32 increases physical activity in long COVID, decrease fatigue, muscle, chest, and joints, pain, and might be useful for preventing progression of renal failure associated with increasing creatinine. I will show now on this in details. For example, here is comparison of placebo group and Adapto-32 groups, and this is measurement at the beginning of the study, in the 7 days, in the 14 days. Here they stop to take preparation, and here is follow-up period. And it was measured duration of walking in minutes, and we can see that starting at the last day of treatment, there was significant difference between these two groups. In effects, they walk longer, and their workout actually was higher, and this even higher difference was at the end of the follow-up period. And these are the same, but as I said, changed from the baseline. Baseline here, like in previous study, here all of them, most of them are on the level of 0. And here, what is the change from the baseline in this group? Here is it. And here is the change from the baseline in this group. In this case, we can see just effect of preparation. If the difference between these two lines is significant, it means that this preparation is active. Because sometimes you will see effect of placebo, you know, that patient could take placebo and have very good therapeutic effect. And this phenomenon is happening at least in 40% of patients in many diseases. So actually we subtract effect of placebo from our measurements. And here is another thing. So curative and stress protective effect adapt during convalescence. This is number of patients with symptoms of fatigue. Solid line is for Adapto-3 group, and dot line is for placebo group. So number of patients with fatigue is less in Adapto-3 group than in placebo. For example, when 50% of them, so this is not so good example, but this is better. On the day 11, the difference between these two groups is much more, is statistically significant. And here is duration of pain. Here is even better difference and even better effect of Adapto-32 on the day 11. So what we can say, on day 11, only 35, about 40% of patients of Adapto-32 still have pain, while in placebo group 60% of patients still have a pain, 20% difference. Objective parameters, you know, so-called cytokine storm. This is interleukin, which is significantly increasing during COVID, and this is pro-inflammatory cytokine in blood, which initiate damage of lung, and this is quality marker, not quality, it's marker of severity of inflammation. So in placebo group, it was on the same level as at the beginning, while in Adapto-3 group, at the end of the follow-up period, there is significant difference in this marker. it's low than in placebo group. And most significant results were unexpectedly for creatinine. Creatinine also is a marker, inflammatory marker, which involved in damage of kidneys. And there are many publications now that many of COVID patients have severe problems with kidneys, and particularly after acute phase in long COVID syndromes. So what we see in placebo group is increasing over the time, but in group of Adaptogener it's decreasing. And difference between these two lines is very significant. That it's speculation, but we can conclude or suggest that it could be beneficial in order to reduce risk of development of renal failure, kidney